Thank you, Dr. Neha. Good morning, good afternoon, and good evening. Welcome to 1813th day of continuous and uninterrupted session of IFPH. Let us start today's program with a silent prayer for a minute. Thank you and welcome back. Today we have with us Dr. Roy K. James, MBBS, DGO, and BHMS student, junior consultant in OBG in Kerala Health Services, MBBS from Johar Medical College, Assam, DGO from Government Medical College, Trivandrum. Now pursuing BHMS at Government Homeopathy Medical College, Kozhikode, Kerala, out of sheer passion for homeopathy. The topic is Homeopathy, the road not taken. So, on behalf of IFPH, I'm Dr. Roy K. James. You can proceed. Please start.
Yes, good evening all. Good morning and good afternoon. Thank you, sir, for this wonderful opportunity. And I had participated in the last IFPH seminar for the first time. It was my first experience with IFPH regarding the problems faced by the BHMS students. And it was indeed a very wonderful session. And it was an immense pleasure participating in that session. And so I had decided to carry on with further seminars and further sessions with IFPH. And here I am today discussing the topic, that is homeopathy, the road not taken. And the title, the very title of today's session, I had borrowed it from the famous poet Robert Frost, from his poem, The Road Not Taken. And it's indeed the same ideology that has driven me to the path of homeopathy, just like the poet has depicted in his poem. So homeopathy, for most, it remains a road that is not taken. So for most, it remains a road that is less traveled, that is seen, less treaded on by others, and they seldom have many to follow suit. So it remains a very vague road or a very vague pathway where you can tread with confidence, unlike MBBS or allopathy. It remains so. I would say that it's because of the lack of confidence for the most of the students who pursue homeopathy, that starts right from their admission. And for me, the story is quite different. For me, I'm a second generation homeopath. My mother, Dr. Geeta Jose, who had passed away 2 months back, she was my mentor, she was my teacher, and she was my first doctor who introduced me to the world of homeopathy. And to mention my gratitude to homeopathy, it's like thrice I have been saved from death by our own homeopathy, by this magnificent system of medicine. For the first place, I wouldn't have been born if it had not been for homeopathy, because I'm the first eldest son of my mother, and when she was term and in labor pain, she had gone in for an obstructed labor. And what happened is that in the labor room on that very day, there came another 2 pregnancies that were also complicated, and the attending gynecologist, who was also an acquaintance of my mother, had to go for the other delivery, and it turned out to be a cesarean section. And my mother had gone in for an obstructed labor, and she could sense that the Bandel's ring was forming in. And eventually, if it had progressed, I wouldn't have been born. And by the time the doctor, if it had followed the natural course, by the time the doctor had returned from the initial part delivery, attending the initial delivery, I would have been an intrauterine demise. So my mother, who had sensed that she's going in for obstructed labor, had taken Pulsatilla 30, and it had saved my life for the first time, even before I had seen the light of this world. And that is my first and foremost experience Then again, in my childhood, when I was just 5 or 6 years old, I had fallen into a pond, and I couldn't take breathe. It was like near drowning. Yeah, I was being bathed by the side of a pond, and what happened is that water had gone into my nostrils and my mouth because I was crying violently, and my aunt was actually bathing me, and I had gone in for an asphyxia. Hmm? And what happened is that by the time she sensed that something is wrong, my whole body had turned livid and I had gone in for cyanosis. And she started screaming. Everybody came running around, including my mom. And when my mom saw me, she just forgot the entire circumstance and she just wept like any other mother would do. She couldn't control her emotions and she just forgot herself that she is a doctor. She just wept like anything. And then my father asked, "You have some medicine in homeopathy that you give for all this blocked noses and or for suffocation? You often say you have saved some people or some children with that medicine. Why don't you give that medicine?" And then she gave me Antimtart to smell, Antimtart 30. That medicated pills was there. She just sent my father for the medicine. He came back with that. And when I just smelled that medicine, I was back to my life. I was back to normal. So again, homeopathy saved my life in time, because had I gone in for more and more asphyxia, there was hardly time for to take me to another nearby peripheral allopathic hospital, and I would have been brought dead in the hospital. So that was the second time I was saved with homeopathy. And the third time is that later on I had contracted rubella. Mm. So, and this rubella, my mom couldn't identify it initially that it was rubella, because I was playing around like anything as usual. I had the fever, she had given me a medication, and I was playing around. And what happened is that that fine morning, I had gone into my cousin's house, and there I had a very good play, and later on I had prawns and some seafood with shellfish and all. And by the time I returned home, my mother was calling me, why are you becoming late? You just come back home early. But I returned home early after sunset. And by that time, my fever had skyrocketed. And by almost 8 p.m., after I reached home, my fever had become like some 104-degree Fahrenheit and all. And later on, she found out that I had this prawns and all, which had aggravated my fever. And it was not at all touching the baseline. She tried many remedies, but it was not touching the baseline. Then she called her teacher, her mentor, Dr. Ismail Seth, and he prescribed a medicine, and that again saved my life in time. So these three instances from my childhood stands as a rock solid foundation for my firm belief in homeopathy. And since my birth, I can vouch that I have not taken an antibiotic or my entire life, not just because I didn't have any infections. I have had almost all kinds of childhood infections, including appendicitis, typhoid, you can just name it. All the infections I have had because I was a very active child who used to play in mud and dirt. And I have had all kinds of infections, but all was cured with homeopathy. There was not even a single instance where I had to take antibiotic. Even I had recently had my wisdom tooth removed because it was impacted. Again, an dynamic disease because of my improper jaw formation. I had an impacted wisdom tooth and it had to be removed surgically. And it was removed by putting an incision, and it was surgically removed. It was quite a surgery of its kind, and usually the doctors would prescribe antibiotics at least for 5 or 7 days. And the attending doctor, I had told that I am not going to take any antibiotic just even before the surgery, and I am not going to take any kind of painkiller. And I had taken just Phytolacca 30, a single pill, And once the local anesthetic, of course, local anesthetic was given, and once the local anesthetic had weaned off, this pain started. It was excruciating pain. So initially I took Phytolacca 30, and later on the swelling and all, it subsided. But after 2 days, when the pain reappeared, I taken Phytolacca 200, and later on Arnica 30 after a few days, and it healed without any events. It was uneventful recovery from that surgery. And again, in the next month, I went back for removing my next wisdom tooth, and he was astonished. Okay, so even then I didn't take any kind of antibiotic or painkiller. It was all managed with homeopathy. So that stands as my clinical testimony from my personal experience why I had chosen homeopathy. And coming back to my childhood, so once I graduated, or I passed out my 12th standard, I was going in for an undergraduate course. I had this firm belief, and I had firmly decided that I would only take up BHMS, because to whomever asked me what you want to become in future, I used to say that I want to become a doctor, not just a doctor, a mighty BHMS, homeopathic doctor. I used to specify this thing, and everybody, including my teachers and including those at the entrance coaching center, everywhere they used to ask me, why are you spoiling your career? You have got a good aptitude, and why do you want to go behind this homeopathy? You can go for allopathy easily. You can just go and score over there. Why do you want to waste your life? This is the things they used to ask me. And again, I used to describe all the same narrations, just what I have told right now. And they used to stand with mouth agape. They couldn't believe any of these things, and they used to say, they used to think that, okay, it could be my hallucination or something that of sort, might could be my fantasy or something of that sort. But again, that was my firm decision that I would not be going in for MBBS. But fate had something in store, something else in store for me. But what happened is that when the results came out, it happened that in the state entrance, I had secured a rank by which I could go in for BHMS right in the government homeopathic medical college Kozhikode, just 200 meters away from my home. And in All India quota, I had secured a rank that I could get an MBBS seat in Assam, and where it was like 2,200 kilometers away from my home. So my mother, she took in the decision that she just told me that you won't regret this, Roy. You just go for MBBS now for time being, and I would give you my word that in future you would take homeopathy, you will take homeopathy. That's my word. So with half-hearted and a mind full of frustration, I joined MBBS in Assam in the year 2011, and I completed my MBBS by 2015. So all throughout my studies in the in allopathic medical college, my only thought and my only dream was to join homeopathy someday, and that remained my the fire within me, because all my classmates, there was a batch of 100 students, all 99 of them were very much thrilled to join this MBBS course, and it was only me who had joined the course half-heartedly. And my attitude also towards the course was again different. I had a very grueling journey in the first year of MBBS, and by second year, when pharmacology started, my only mission was to find out the side effects of all these drugs. I wanted to find out how these drugs won't work in the human body, and what are the kinds of side effects these drugs will produce inside the human body. And that was my method of studying. And I think that method helped me a lot by the time I passed out of MBBS course, because by that time I was well versed both in the action and both in the indications and as well as the contraindications of various allopathic medicines. And I would know that why these medicine had so kinds of side effects in each of its indicated diseases and all. So again, after passing out MBBS, I came back to Kerala for my house urgency, and I was getting prepared to join BHMS. Again, I asked my mom, why shouldn't I take up BHMS right now? I'm ready. I can go for the NEET entrance, NEET UG entrance this year, and I would take up homeopathy. But again, she told that you just wait, it's not time. So I was again immensely frustrated. I had gone into a kind of depression that I couldn't take up BHMS. And she told me that, Roy, you won't regret this decision. I'm telling you whatever these things, it's all for your own good. In future, you won't regret this. So again, I trusted her. I wrote the NEET PG entrance. In the first try, I couldn't get it. Again, I repeated for NEET PG entrance, keeping the fire of homeopathy within me. Whenever it was a very grueling journey, because there was long hours at the PG entrance coaching classes, 12 hours and all we had to spend in the coaching class and come back home and read again for another 4 or 6 hours. So it was like 24 hours a day was not enough to prepare for this NEET PG entrance. But again, it was my passion for homeopathy that kept me alive through all those grueling journey. And I used to share my love for homeopathy to my most close friends in my PG entrance coaching classes, and they used to tell me that you are actually mad, you doesn't have a future. But still, again, seeing your passion, we feel that there is something that could be done with homeopathy. Again, you don't waste your time fantasizing about homeopathy. Just focus on what you're doing right now and just get past through that. So finally, I got into government medical college Trivandrum. Government Medical College Trivandrum in 2019 in the Department of Obstetrics and Gynecology. I had secured a rank and got into DGO. And I studied a DGO for another 2 years. It was a 2 years course and 1 year senior residency. So I had passed out from there with the 4th rank in the university exam and had secured the endowment award, Dr. Kalyanikutti Endowment Award for the best PG student in DGO for that year from the college. And all my professors who had taught me, who had stood by my side, they were all happy for securing such a good rank over there. And again, my mentor, whom I had worked in her unit for nearly 8 months, she was very concerned in my case. She used to ask me after 3 months into her unit, what's your future plan? And I never divulged my my passion for homeopathy to any of my teachers over there. I just used to tell her, I have a plan, ma'am, a very different plan, and at the right time, I will tell you. So after my senior residency was over, I told goodbye to the hospital, and I told her that I'll be pursuing a very different course and you would see it in near future. So once passing out of the medical college in 2022, I got a posting in the government Taluk Hospital, Koilandi, here in Calicut under NHM. And after working for 6 months over there, I had gotten into the Kerala Government Health Service through Public Service Commission's posting. And I was placed as a junior consultant gynecologist in Palakkad, in Attapadi, in a tribal specialty hospital, Kottattara. And the hospital turned out to be a very difficult part or a very challenging hospital, and I had loved the job over there, the challenges over there, because referring the patients was never easy over there. So again, over through all this 1 year where I was worked at Calicut and in Palakkad as the consultant gynecologist, during my free time, I used to take the 12th standard NCRT textbook into the labor room, into the doctor's doctor's lounge, and I used to read biology, physics, and chemistry from there. And I prepared for homeopathy. So only a few staff over there had seen me with these books, and only then they had asked me what I'm doing with these textbooks. I just told them that I'm preparing for something big. You will know in your time. So during that journey, this NEET UG entrance exam came, and I took leave from the hospital stating some other reason, and I went and wrote the examination, and finally I got admitted to Government Homeopathic Medical College, Kozhikode. So then my everlasting passion for homeopathy had finally blossomed. I had secured admission to Government Homeopathic Medical College, Kozhikode, and that became my turning point, or what to say, my most revered position as a student in my entire life. And I had secured admission in 2023, November 1st, in this college. And right now I am pursuing BHMS. And again, one instance in particular that I would like to state is that during my house urgency, when I was doing my house urgency, I came back from Assam to pursue my house urgency in Kozhikode Beach Hospital, General Hospital, Kozhikode. And what happened is that my mother, she had suffered from a hemorrhagic stroke. One day she was taking bath, and suddenly she had gone to take bath, and after a few minutes I heard her screaming my name from the bathroom. And when I reached there, she had somehow put on the clothes, and she was just leaning onto the door of the bathroom wall. And I asked her what happened. Is that she just motioned me to come near her, and when I went near her, she just fell onto my arms. And I was actually confused as to what had happened. And later on, she just told me to check her BP, and when I checked it, it was like 220, 120. Then she had gone, the angle of her mouth had gone paralyzed, and she just told me through that she had mumbled that to give her arnica 200, single drop on her tongue. And I gave her that drop, and then only I realized that she have had a stroke. Then I was very furious, and I just told her that I will take her to the hospital, I will take her to the ICU. But she just told that don't do anything irrational, just keep a watch over me, and only if you feel that she is deteriorating, she is not coming up, then only you take her to the hospital. So the whole night I stood guard at the doorstep of her bedroom, and I kept watching her respiratory rate. And in the morning by 6 a.m., what happened is that I had drifted off to sleep, and suddenly I realized that, oh, it's something had happened. When I woke up from my sleep, I found that she was nowhere to be seen inside the bedroom. I scanned the entire top floor of my house, and that time I heard some noises from the kitchen downstairs. And when I went there, what happened is that she was trying to wear a chappal, a pair of slippers, and she couldn't succeed with it. And I asked her what she is doing. She told that it's morning, it's already late. She want to make food for everybody. Then I scolded her. I asked her what you're doing. You know what had happened to you last night, right? And why you are here. Then I noticed something, that she had come all the way walking through the stairs from the top floor all by on her own self. Then I noticed that even though she is not able to wear the slippers, she is able to walk. The other day, she had undergone a left-sided hemiplegia and had fallen onto my arms. But today she is standing on her own. And in the course of next 3 days, I saw her recovering from that stroke, all with the power of homeopathy. The very next day, her arms came back to full power, and in a week's time, her deviated mouth and tongue had also become fine, and she was back to normalcy. And what happened is that after 7 days, she told that there are patients waiting for her in the hospital. She wanted to go and attend to those patients. They had come from long distance. And I vehemently tried to stop her, but she wouldn't budge. And then when I told her, okay, I would accompany her to the hospital, we'll go and I'll accompany her to the department also. So when I accompanied her to the hospital, all her colleagues and all her friends, all the staff over there, they all came running after seeing her, and all of them gathered around her. I still remember that scene from 8 years ago. And everybody started asking what had happened to you. Heard that you had some BP and had some giddiness and all. And then only I divulged that news to the world that she had a stroke. I hadn't shared this news even to my uncle, my maternal uncle, her own brothers, even to my father, even to my brothers. It was kept a secret between two of us. And then only the outside world, her colleagues and all came to know that she have had a stroke the other day. So everybody started scolding me. Why didn't you take her to the allopathic hospital, to a tertiary care center in those times? Those moments were very critical. But I told, no, now you just look at her. She has come back fully well, fully recovered from that stroke, and she is all well. Then again, they were asking me, I am an MBBS laureate, UG graduate from allopathic medicine, and you don't have your senses to take care of her. If had something at all had proven wrong, what would have happened? But I told that everything is fine. But again, in the next few days, she didn't take rest. So eventually, I had to take her to an allopathic doctor. My medicine professor. And my medicine professor, after examining her, told that most probably she would have had an ischemic stroke. Chances for the hemorrhagic stroke is very less. Anyway, let's take an MRI for detecting what had happened. And she was taken for MRI, but because of claustrophobia, she couldn't take MRI. So eventually we had gone for the CT, and in CT, this astonishing finding came up. There was a large, pretty big area with the penumbra, means the area, it was fully flooded with blood the other day, and now the umbra, or the actual hemorrhage that is left over, is only the size of a 0.5 centimeter or something in the thalamic region. The whole penumbra is still edematous, and it stands as a proof that quite a big hemorrhage had occurred. But with the power of homeopathy, with that single or 2 doses of arnica 200, that whole hemorrhage was absorbed back, and now she is back to her life. And when I took her back to my medicine professor, he was astonished. He told that he hasn't seen something of this sorts, and he told me to continue with homeopathy. And again, for the next 5 years, it was uneventful. She went on normally with her life. She had become the superintendent and the principal of Government Homeopathic Medical College, Kozhikode. And later on in 2022, she had her second stroke, and even then homeopathy had came for her aid. She had a deviation of mouth again on the left side and all, and this time she had come back to life within a span of 1 week. So that's my strong testimony for the power of homeopathy. And that stands as my turning point to stay strong and fixed with my decision to continue studying BHMS. And lately, in the 30th of April this year, she had a rupture of the mitral valve, of the caudate tensioning of the mitral valve, and she had a severe mitral regurgitation. And what happened is that eventually we had to take her to the hospital because it had to be surgically fixed. Otherwise, I wouldn't have taken her to the hospital. It was only just because it was a surgical emergency we had to take her to the hospital. myself and not even both of my brothers were interested in taking her to the hospital, and only for that reason we had to take her to the hospital. And finally fate gave in its way. She had undergone surgery successfully, but in a matter of few days she had succumbed to death. And again, in the pre-op, post-op period, she had a stroke, an embolic stroke this time. Despite being on antiplatelets and a truckload of anticoagulants, she had an embolic stroke, and the doctors in the hospital told that nothing could be done. So she was discharged home, and at home we had given her Carbovesh 200, one drop dose, and the very next day the left arm that had only grade 2 power from the hospital, she shifted her whole weight in bed with the support of that left arm, and she had shifted her weight. But eventually pulmonary edema had set in because of the complication of this surgery. Means mitral valve replacement, it would take nearly 3 to 6 weeks for the hemodynamics of the heart to adjust with the new valve, and she had developed pulmonary edema, and we had to take her back to the hospital. But later on she had suffered from an intestinal obstruction, and we were not allowed by the hospital, we are restricted by the hospital authority from giving any kind of homeopathic medicine, despite the doctors over there saying that there doesn't have anything much to do than give supportive care and to remove the intestinal obstruction surgically. But thankfully she didn't undergo surgery, another laparotomy for this thing. It was reduced with colonoscopy itself, but later on she had succumbed to sepsis and had died just in the 21st of May 2025, just 2 months back. So that stands as a very big loss as far as I am concerned, because she was the stronghold and the strong pillar behind me and our entire family, and my hope in homeopathy. But still I have become more and more fervent and more strong believer in homeopathy, because even during this time I had seen what homeopathy can do, what wonders it can work. So what's now the question stands as to what's my future. So my future, it's not, everybody now asks me what's my plan in future. And my plan for the future is not to completely neglect the allopathic side of medicine that I have studied. The allopathy side, where I have passed out as a gynecologist, I have the skills of a surgeon as well as that of a medicine doctor. So the skills of surgery would come in very much handy whenever I am handling cases that would require a gynecological or obstetric procedure. Not all cases can be managed with homeopathy. That stands as a limitation of homeopathy. Of course, in adynamic cases, surgical interventions and other procedures has to be done, and even Hanuman has testified that some additional arrangements has to be made so that the vital force can cure the disease and correct the functions of the human body and get it back into harmony and get it back into health. So that future, my future, so it has to be a combination of the surgical procedures or my surgical knowledge from the allopathic side of medicine, and it has to be combined with the medicinal action, the wonderful medicinal action of our own homeopathy. So everybody, most of them used to ask me, are you actually going to combine both the allopathic medicine and homeopathic medicine? And again, that won't do any good. Combining allopathic and homeopathic medicine would again bring in catastrophe. Catastrophe in the sense that homeopathy, when combined with the allopathic medicine, the action of homeopathy, it will be reduced. So it is not practical to practice homeopathy in combination with the allopathic medicine. We do have wonderful medicines from our side that could that cannot be compared with the antibiotics, with the antibiotic resistant bacteria, and poses a challenge in the allopathic medicine or in the modern medicine. And every day new superbugs and new superbugs are coming up which are resistant to almost all kinds of antibiotics. But for our homeopathy, there is nothing like a superbug or a drug resistant bacteria. Our homeopathy works by the natural laws of cure. And our medicines can cure any kinds of infection, especially this surgical, post-surgical infections can be dealt with beautifully with our medicines with much less suffering to the patient. Even in case of gynecology, whether it be fibroids, whether it be adenomyosis, endometriosis and all, in all these cases, especially in infertility and all, we have had good results. And all these experience I'm sharing with you is from the cases that I have seen my mother curing all these cases, difficult cases with homeopathy. She has practiced homeopathy truly and she has stood strong in the cardinal principles of homeopathy by administering a single remedy at a time at the minimum dose and repeated only at appropriate intervals, just as our stalwarts has done. And I have seen that has produced wonderful results both in acute as well as chronic cases, and even in emergency cases, not just within our family and also for her patients. I have seen her manage these wonderful cases of emergency cases with homeopathic medicine and without any further complications. So for being a successful practitioner, this adherence to the cardinal principles of homeopathy is very, very much imperative. Without these cardinal principles, whenever you say that you practice homeopathy with less regard to the cardinal principles, then it's not homeopathy. You might be administering homeopathic medicines for sure, but when you are practicing outside or when you are giving less regard for the cardinal principles, then it doesn't become homeopathy. It just becomes a pure administration of homeopathic medicines. And from all the experience right from my childhood, I have seen that most of the patients who had attended our clinic, my mom's clinic, had come after grueling journey of especially these infertility cases, after these grueling journeys through a lot of allopathic clinics, and after consulting a truckload of Ayurvedic practitioners, homeopathic doctors and all, they come without any results, all in vain, just in the hope of conceiving. And I have seen my mother cure all these cases with this single remedy, single minimum dose in appropriate intervals. All these remedies, when given in accordance with the cardinal principles, will bring in beautiful results that cannot be matched with any other system of medicine. And again, this clinical exposure. So the last session when I had attended regarding the difficulties faced by homeopathic students, some were saying that this clinical exposure stands as a limitation for them to practice. Means the lack of emergency cases, the lack of knowledge regarding these emergency cases, lack of exposure to surgical cases actually retards them from their clinical practice. But I don't think that's true. Because of course adynamic cases would need surgical management, but in the case of when homeopathy is concerned, in most of these emergency cases like burns and all, we do have much better medicines compared with allopathy. Our Cantharis is a very wonderful medicine that works wonderfully during these burns and all. Not for all burns, but of course the superficial burns and all, it works wonders. compared to the silver salicin or the silver compounds applied during burns and all. Our Cantharis has got a much mightier action and it heals without any scar formation. And even in the post-burn cases and all, with immense contractures and scar formation, our medicines do have a very wonderful curative action, and that can bring in the normal skin back to life, delaying all these scars and contractures that have formed. It removes naturally all these scars and bring back the original beautiful skin. I have seen these cases from my mother's clinic, and again that stands as a testimony that where allopathic medicine stands limited and where surgery, even surgery can't prove to be of any good. Even in these cases of contractures and acid burns and all, our medicines can work wonders. So this clinical exposure to emergency care is actually, of course, it can be a limiting factor, but what actually limits the students of homeopathy is their lack of confidence in the first place and the lack of knowledge. So this lack of knowledge, it starts from the case-taking aspect. The case-taking that is taught right from the first year or just introduced, and all the students are introduced to the methods of case-taking right from the first year. But still, they seldom give their hearts and minds to why such a kind of a case-taking has to be done. It just appears to them like some piece of mockery or some kind of an abstract idea why they should be taking a case in detail. Even I have seen students of final year struggling with case taking. They doesn't get into the idea why this case taking has to be done. This elaborately, so elaborately, and they just do some kind of, they just do quick fixes to make a case or take a proper case history. They just take a case by quick fixes rather than taking it elaborately, rather than pointing out to the most peculiar and the characteristic points of each symptom in a case. So, right, that foundation, case taking is the foundation of homeopathic therapeutics, and when somebody fails in case taking, the whole case goes wrong. And the next thing that stands as a problem for the students of homeopathy is the reading habit. They should have a good vocabulary, and a good reading habit has to be formed so that they can process a lot of these data. Compared to a normal allopathic MBBS student, a homeopathic student has to put in almost 3 to 4 times of effort in learning all the theories or all the ideology behind this wonderful system of medicine, and a very few students does that. And this because they doesn't get into the core of the subject, or the core of the subject, that is organon and materia medica, the soul of our subject. In both these arenas, our students lack in-depth knowledge, and that's the very reason that's actually pulling them back. When once they are out of the college and out of the umbrella of care of their professors and teachers, they are left alone in the forest of diseases, and there they doesn't have the enough armamentarium to find and search out for the remedy. It's this very lack of confidence that paves way for the lack of knowledge in these two beautiful subjects of homeopathy that actually pulls them behind. It's not the lack of IT knowledge as thought by many. IT knowledge in the sense in operating a digital repertory or a computer-based repertory program like Radar and all. Even when you are referring a repertory in homeopathic case taking, the students initially they have to start referring a repertory by the book, not in the digital form. Why? Because it stands as a simple example of a child or a student reading a news from a newspaper and from an online media. See, when you read a news from an online media, your focus just remains only to that news, and only the similar news with the similar interest are shown to you, and you remain oblivious to whatever is happening anywhere else. But when you're reading a newspaper, you come across different varieties of news from each and every corner and each and every genre. And that will explode you with a lot of knowledge. Same happens when you refer a repertory and in the book form. Then that you will come across a lot of other rubrics. You might be referring this repertory in search of a single rubric. But when you open that book, you come across a lot of rubrics that you might have missed, or you may not have noticed in your entire life, or you may not be noticing it later on in your life. So it's less like when you sift through the pages, you will come across different kinds of rubrics. And why these rubrics are important? It's because, again, this helps you in case taking. The student has to be familiar with the importance of these rubrics and its implications in case taking. And this use of repertory, again, it remains a debatable topic, because the use of repertory has to be done in moderation. And just like the Malayalam proverb goes, like, even if it is an heavenly decoction, even if it is in excess, it becomes a poison. So anything in excess becomes a poison. Just like that, the use of repertory should be done in moderation. If you use repertory too much in your clinical practice and in prescription, what will happen is that you will be totally oblivious to the kind of knowledge that the materia medica could provide. It might be the remedy, the actual simillimum of the case could be something else that could be out of the list of medicines that is mentioned in the repertory. In reality, it could be some other medicine. And again, if you are practicing without repertory, you will miss out on these rubrics. You will miss out on some rare medications that are not in your knowledge of materia medica, that you have not read in your entire life. So you will miss out on these things. So the use of repertory has to be done in moderation. Nowadays, what happens is that most of the new doctors, young doctors who pass out of this course, they are practicing with the help of a laptop. There will be a laptop in front of them. They'll just type a few keywords. They will get the medicine, and most of them will get a list of medicines, and they would actually prescribe from that list of medicines. So that is not the practice of true homeopathy. A true homeopath should know when and how to refer the repertory and to club it with the knowledge of materia medica. So only when you have an in-depth knowledge of the principles that is laid down by the organon, and an in-depth knowledge of drugs in materia medica, at least from the polycrest remedies. For most of the cases I have seen, whether it be gynecology, whether it be surgery, most of the cases can be wonderfully dealt with polycrest remedies. So if you have an in-depth knowledge of these polycrest remedies and a few tissue remedies, of course, you can have wonderful results in most of the cases. And it's quite rare that you will be needing something out of these polycrest remedies. It is quite a rare event. Not very rare, but of course, a lot of diseases can be managed with these polycrest remedies. So the BHMS students, they should have an in-depth knowledge in materia medica in all these polycrest remedies. And again, the scope for integration of research between allopathy and homeopathy. And this topic, it stays as a very vague area, because in allopathy right now, all the research works, everything is based on randomized control trials or something of the part like whether a single drug is effective for a particular condition. So that's how the research methodology in allopathy it's working. But homeopathy, being a holistic system of medicine, it's never the way that we prescribe medicines, and it's never the way that our medicines acts. It could be a single medicine would be useful in a lot of diseases, in a lot of different scenarios.
Excuse me, doctor. We can give 5 or 6 minutes for interaction.
Sure, sir. So again, I'm falling short of time. So again, I would conclude that. So this integration is a very tricky part to be true, and it has to be done carefully. So only our clinical case records as a single case record for a single remedy can be given as a proper proof for research methodology. So this area of integrated research, it needs more and more diverse methods of study. With the present existing tools for research methodology, I think it would be very difficult to prove the effectiveness of homeopathic remedies. So something kind of meta-analysis where a single remedy can be used for the therapeutics of a lot of different conditions has to come up. Only then there'll be a strong research foundation for homeopathy. Just a simple integration of both research on modern medicine and research in homeopathy wouldn't do much good. So thank you, and thank you for the patient listening.
Yes.
And please.
Very courageous personalities, Dr. Geeta Jose and Dr. Rohit K. James, no doubt about that. A nice presentation, and also it should be an eye opener to those who are rushing to the MBBS course, even though they are living with homeopathy. Their bread and butter earning always on homeopathy, but they are always paying attention or willingness to study allopathy. Rare exception. Thank you, Dr. James. Now it's time for discussion. Dr. Nasia is there. Yes, please, you can unmute now. Dr. Nasia, please.
Yeah, thank you so much, Doctor. I really, what I should say, he is like an inspiration for each and every doctors, homeopathic doctors who are not practicing, because as he said that when he kept one session for the difficulties facing by the homeopaths, in that he discussed that the homeopath says that it is a lack of clinical experience and lack of clinical knowledge, as we should do the holistic approach, and that is not our part of pathy. That the thing which really deteriorate the confidence and the confidence and the self confidence, and it really led the doctors, homeopathic doctors, let down. And that is the only thing. Because of that, the doctors feel the homeopathic doctors are homeopathic doctors feels like this is not good which we have done. We should do something else, or like we should do the other than this, or we should practice as in Maharashtra. It is like this. The homeopathic doctors can practice. I don't know about other states, but as I heard about the Kerala doesn't allow the homeopathic doctors to practice or sit with the allopathic doctors. But in Maharashtra, it is very common. And because of that, the homeopathic doctors are only running to this, only running in this, just going to the hospitals, joining any specialty hospital, then doing the work over there, then learning each and everything. So they are just leaving the homeopathy back. So that is very nice thing which he shared, and his story was really very inspirational. And I must say, Doctor, you have done very well.
Yes, thank
That's
you,
so great,
Dr.
and
Yes.
thank you so much
Okay.
for sharing your story here. Thank you so much.
Okay, now Dr. Ganesh, please. You can unmute now, Dr. Ganesh.
Yes, doctor. Roy, it's really an electrifying session. You really motivated all of us, including the doctors here, because you come up with your experience in the what you got from your home, and then what are the things you learn from your home, and how it can be implemented. Everything you were able to understood from your mother, and she has done a lot of good work for homeopathy, and she even presented some of the best papers in our forum, and all those things. We cannot forget her because of that. She had lot of students who were really having excellent practice also. So all in all, in the end, you also come up with how to use the repertory and when to use. This is a very good thing, because most of the people nowadays, as you rightly point out, are sitting in front of the patient, and then looking at the laptop and clicking this and that and finding a remedy and giving it. But it is not the way. When you find a remedy in quite similar to the one of the patient, then you have to look into the materia medica and make sure that the remedy chosen is absolutely right one. Then only the patient, your medicine will work, and that will give you the permanent cure. Anyway, congratulations, doctor. Jose sir is waiting. Thank you. Thank you. Hope we can have some more presentation, because we will have to upload these things, and all the students of homeopathy should watch this video, because this is a powerful one that will definitely motivate all the students of homeopathy. And not only students of homeopathy, those who have just completed homeopathy, BHMS and MD, but still they are not practicing. So it is an eye-opener for all of them. Thank you, Doctor, once again.
Thank you, sir. Thank you for the
Okay, thank
platform.
you, Dr. Dhanesh. Yes. And now it's time for Jose Isaac sir. He's the classmate of Dr. Geeta Jose, of course, and a lot of experience with him. And sir, please, you can make your comments as well as conclude the session. Yes, sir. Please unmute, sir.
Okay.
Yes, thanks also, sir.
I
Yes.
was a classmate of Dr. Geeta Jose and then a colleague as a teacher in the Government Homeopathic Medical College. And I know Roy very well from childhood. Yeah, I think he has homeopathy in his DNA. Your passion is an inspiration for many students as well as doctors. And also, I would like to remind you that most of the great authors and practitioners of homeopathy were converted allopaths. And one day, I'm sure that you will become one of the leading doctors in India as a homeopath. Wish you all the best.
Sir. Thank you. Thank you, sir. Sir, I would like to call myself a doctor only from deep down my heart. Only once I pass out this BHMS and I start practicing homeopathy on my own. Because only then I can be 100% sure that I am rightfully curing the patients in front of me. Because through allopathy, I know I am able to check the diseases, the symptoms for time being, but it's not cured. It's still lurking behind the system. But with homeopathy, I can uproot the entire disease pathology and the root causes for the disease that's there lurking in the system of people. So rightfully, I'm waiting for the day when I'll be passing out this BHMS.
Yes. Not only you, but also we are all people. Then you said about
come again to this forum again and again. Okay.
Sure, sir. Sure. Thank you. Thank you for the platform.
You mentioned about a couple of your turning points, and I am sure that this is one of the turning point. Your presentations that participate in IFPH will definitely a turning point in your life. So
Yes.
it's time to wind up the sessions. We'll back again tomorrow. Till then, goodbye, and Dr. Tyler to continue the program. Thank you.